March is National Colorectal Cancer Awareness Month. It is the perfect time to make sure you're doing all you can to prevent it and get the necessary screening for early detection. And joining us now is Dr. Patrick Harris, a gastroenterologist with digestive health specialist. How are you doing, Dr. Harris?
Hey, I'm doing great. Thanks so much for having me here to discuss this, important topic. As you mentioned, March is Colon Cancer Awareness Month, so it's important for us to raise awareness, about the impact of the disease and to really emphasize the importance of prevention with screening.
Okay, and thank you so much, Dr. Harris, for being here with us. With you being at Digestive Health, are you seeing an increase in people, especially younger people, being diagnosed with colorectal cancer?
Yeah, certainly. So colon cancer is certainly something we encounter as gastroenterologists regularly. It is the third most commonly diagnosed cancer among men and women in the United States, and over 50,000 people will die of colon cancer this year. And then we're really seeing an alarming increase in colon cancer in younger patients, in those younger than age 50, to the point that colon cancer is now the leading cause of cancer-related death in patients aged 20 to 49. So yeah, certainly.
And when it comes to colorectal cancer, this is by far the most preventable cancer as well as treatable.
Right. So, colon cancer, like I said, is common and it can be deadly, but the good news is it's the #1 most preventable cancer with early detection, screening with colonoscopy, and then oftentimes treatable if it's caught in the earliest stages.
Now, how can people lower their risk?
Yeah, so you'd say who's at high risk for colon cancer? That would include those with a family history of colon cancer, certain types of genetic conditions, and then those with inflammatory bowel disease. Other ways to reduce the risk would be other kind of lifestyle factors, such as diet. A diet low in fiber and high in fat or high in processed meat has been shown to increase your risk of colon cancer. Also, lack of regular physical activity and obesity or being overweight has shown to increase the risk of colon cancer. And then really, excessive alcohol consumption or tobacco use can increase the risk. So, all these things are important ways to live a healthy lifestyle for a multitude of reasons, but particularly to reduce your risk of colon cancer.
And when it comes to colorectal cancer, there are now a lot of over-the-counter screening products. How effective are those? Yeah,
so there are different approved regimens or kind of modalities to screen for colon cancer. Colonoscopy is really the gold standard because it can both prevent colon cancer by removal of polyps, then also detect early cancers. There are different types of stool-based tests that check a patient's stool sample, and you kind of can mail some of them in. Cologuard might be one that you've heard of, and the way those work is they detect little small fragments of DNA or blood in your stool that could be from a polyp or a cancer. And those tests are approved, and they have good effectiveness. But the important thing to note is that anytime any of those tests are positive, you will need to get a follow-up test with a colonoscopy, and those stool-based tests are not recommended for those at higher risk, such as those with a family history.
All right, anything else you want to say, Dr. Harris, before we let you go?
Yeah, I think just important to emphasize that 45 is the recommended age to start colon cancer screening, and early detection and prevention with colonoscopy really does save lives. So don't wait, and if you have waited, it's never too late because it really can make a difference.
All right. Thank you so much, Dr. Harris, for joining us.